In this video, we will see how to approach the problems relating to gaze and pursuit movement. And now you see the normal eye movements controlled by third, fourth, and sixth cranial nerve connected by the MLF and also the various supranuclear control. So what is gaze? Saccadic movements or gaze means conjugate movement of both eyes synchronously when focusing on two distinct targets. Whereas the pursuit movement is another type of conjugate eye movements when tracking a single moving target or object. This coordinated movement to keep the visual target on macula and holding it together or fixing it is controlled by horizontal vertical gaze centers. This can be initiated as an involuntary movement or by reflexive movement. We'll see the horizontal gaze control first. The horizontal gaze control center is situated at the pars in the name of parapontine reticular formation. From there, the infranuclear fibers reaches the 6 abducens at the same side, then cross over to the opposite side through median longitudinal fasciculus to reach third and fourth cranial nerve on the opposite side. The structures involved in the supranuclear control for horizontal gaze includes frontal eye field, striate cortex, temporal eye field, cerebellum, and vestibular system. To the vertical gaze control, the center is located at rostral MLF, which is located near tectum of dorsal midbrain. From there, the fibers descend to the same side abducens and then cross over to the opposite side, third and fourth nucleus via medial longitudinal fasciculus. The supranuclear control will be frontal eye field, posterior parietal cortex, substantia nigra cardiac nucleus, as well as interstitial nucleus cajal. They all converge to superior colliculus, and then it modulates the vertical gaze center. I will just talk about pursuit control now. Along with horizontal vertical gaze control, the dorsolateral pontine nucleus is involved in the pursuit movement, which is a smooth movement of tracking an object. Now let's look at the unilateral horizontal gaze palsy. Firstly, we'll see left gaze palsy. The eyes are stationed at right extreme position and unable to move or cross the midline to the left side when attempted to do so. And if you see the right gaze palsy, again, the eyes stationed at left extreme gaze and is unable to move to the right side crossing the midline, whereas the vertical gaze is again preserved here. Coming to the bilateral gaze palsy, that's horizontal gaze palsy, the eye is set at neutral position and unable to move either to the right or left side on attempting to do so. Here again, the vertical gaze or vertical movements up and down is preserved. And also the vestibulo-ocular reflex is lost or the horizontal head movements, but vestibulo-ocular reflex is intact or vertical head movements. We will move on to see causes of horizontal gaze palsy. So frontal lobe lesions, epileptogenic lesion of the frontal eye field, parietal lesion, corona radiata lesion adjacent to genu of internal capsule, thalamic hemorrhage, mesencephalic lesion, pontine lesion involving abducens or PBRF, and we will see the vertical gaze palsy now. Firstly, this unilateral downward gaze palsy. The eyes are set at looking up and unable to move down, whereas the horizontal gaze is preserved. Now coming to the upward gaze palsy, eyes are not able to move up but stationed at down position. It's also called a sunset sign. Again, you can appreciate that the horizontal gaze or horizontal movement on eyes are to both sides. Bilateral or total vertical gaze palsy, the eye is stationed at a neutral position. It's not able to move up and down, but the horizontal gaze is preserved. Also, on turning the head to up and down, the vestibular reflex is not intact. When you move the head to right and left horizontally, you can see that the vestibular reflex is preserved. Now coming to the causes of vertical gaze palsy, there's a dorsal midbrain lesion, infarction during stroke, hemorrhage, tumors, hydrocephalus, pineal regional tumors, AV malformation, and multiple sclerosis. We'll also look at the special type of gaze problem. You can appreciate smooth pursuit defect. Here, one eye is moving at constant velocity during horizontal gaze, whereas the other eye is slow but trying to catch up. This is pursuit defect. Includes frontal lobe, posterior parietal lobe, posterior occipital, and temporal lobe. Choir wave jerk or involuntary horizontal saccadic intrusions that interrupt fixation. You can see the eye is not fixed in the neutral position. It's trying to have a jerk. This is called square wave jerks. Causes of square wave jerks include progressive supranuclear palsy, spinocerebellar degeneration like Friedreich's ataxia, Parkinson's disease, and multiple sclerosis. So to conclude, the pursuit movements are essential to track moving objects, whereas saccadic movements are important to see two different stationary objects swiftly. Horizontal gaze palsy results from Fontaine lesion or any lesion involving the supranuclear control of horizontal gaze center. Vertical gaze palsy results from midbrain lesions involving vertical gaze center or its supranuclear control. Clinical diagnosis will help to localize the lesion. Thank you.